Today let's look at our body upside down, soles of our body. Getting into topic, flat foot, I'm going to remind the shape of the foot and its role in walking. Body movements and walking are mainly possible with foot and ankle joint. The main weight of the body is on a semicircular bone called talus, located in the 1/3 of the posterior part of the foot. Contraction of calf muscles moves the foot up and down and pushes the ground, allowing our body to move forward. The foot not only moves the toes up and down from the ankle, but also moves inward and outward to keep the body balanced on uneven planes. The dome shape of the midfoot is supportive for the anatomy and creates flexibility to the foot bones, help balancing to load on prevents fatigue in daily life. Tiptoe stance and walking intensely used in all sports branches, especially running, and it adds more agility. Elevating of the heel alone may conceal the flat foot appearance. Physicians should carefully in patients with high heel shoes. The fail of the dome and the foot causes pressure increase at areas not designed for load bearing, so it creates pain. Complaints such pain and irresistive to long standing or walking may to result or flat foot in clinic. When we look at the underside of the feet, we see an unequal load distribution. Every part of the sole, the skin have not of equal thickness and color, which can be discovered easily at first sight. The loads are concentrated at the areas where the skin thickens. When it's exaggerated at particular points, it turns out to callosities. The unique and irregular shape of the foot has a well-known figure and the word footprint used often in daily speech for describing contact areas of an object. The touch point of the foot generally provides balance on the heel concentrated at outer side of the foot. There is a space between big toe and the heel called vertical arch of the foot. With the fall of this arch, the foot is positioned on a plane with the ground and the person height is shortened maximum to 3-4 centimeters. Collapse shaped of longitudinal arc called flat foot, opposite structure of it names thanks to cavity cavus foot. The structural changes can be easily recognized with naked eye. How and why, when does our flat foot occur? As all babies are not able to walk in the first year, we cannot exactly decide and diagnose the flat foot deformity. In the following years, foot problems overlooked due to balance problems in the first phases, they are just starting to walk. In infancy and early childhood, our legs are shortened in proportion compared to our torso. In this year, subcutaneous tissue, adipose tissue, is prominent in the legs. Since the uppers used until the age of 2 and 2.5 years of infancy, they work as a separator between legs and enhance the approach angle of the feet to the ground. The flexibility of the infants decreases the cavity of the curve and gives the appearance of a fallen arch. Exact diagnosis may be postponed to the age 4 and 5 years for healthy assessment of flexibility and walkability. Other deformities of the lower part of the skeletal system, such as varus knee, back knee, knock knee, should be carefully recorded. Flat foot deformity at childhood heals usually spontaneously with simple exercise and proper follow-up. Rarely needs surgical treatment. Complicated cases with congenital anomalies of midfoot like vertical talus, tarsal coalitions need special attention and care. Basic physical exam should examine these abilities at child: heel walk, tiptoe walk, body balance, and other skills like walking on sides of the foot has to be examined. Despite all this, the development of flat foot may not have any orthopedic treatment value if it is flexible. The rigidity of the foot that flat foot the outward slip of the heel, the high on the toe, the shortness of the Achilles tendon, and the back of the heel should be taken into account. As in all orthopedic deformities, exercises is not be missed by making special shoes and devices. The existence of a condition that may cause a generic predisposition to foot deformity in the family should be questioned, and blood tests should be performed to measure the child's metabolic values. When flat foot cannot be successfully treated with all conservative modalities, surgical treatment should be discussed with the family in the preschool period. This deformity of the foot is not only a cosmetic condition, but also it is a health problem to treat. The younger the patient, the better will be a treatment outcome. There are several surgeries adapted to growing skeletons, otherwise it will bring about negativities in sportive activities and the choice of future job. Mobility disturbances bring obesity due to deprived calorie burn. Flat foot can be treated with soft tissue surgeries in the school age period when the foot does not reach its adult height and maximum height. Placement of the elevating tenodesis screws between the talus and calcaneus bones, lengthening of Achilles tendon, angular correction in the heel and metatarsal bones, tendon transfers are preferred according to the severity of the flat foot. Furthermore, tarsal coalition, midfoot bone anomalies with flat foot, angular deformities in the hallux and laser tooth, juvenile hallux valgus, Taylor's bunion, and other rare bone disease together cause flat foot. Flat foot in adulthood. This is the second main topic of our speech. Flat foot, accompanied by the heel deformity, lose its flexibility and patients become candidates to surgical treatments. Shortening of the Achilles tendon, which develops over time, and spasms of the calf muscles, night cramps may be seen. The presence of an accessory bone in navicular bone triggers insufficiency at the tibialis posterior tendon. The deformed foot over time also distorts the shape of the shoe. In the early stages of the disease, conservative treatment is begun to continue their daily life activities by giving them special shoes and forefoot exercises. The chance of surgical treatment should be offered in patients whose clinical picture doesn't improve without success. Surgical techniques which prevents joints and their mobility are preferred at initial phase of the disease. Unfortunately, osteoarthritic patients are candidates different types of arthrodesis surgery. Also, regenerative medicine solutions like PRP, stem cell applications, and other intra-articular fluid injections may be considered according to patient needs. The use of artificial ligaments in the fixation of bones, especially the reduction of the joints in the forefoot, allows patients less aggressive surgery in coexistent deformities like hallux valgus with soft tissue arrangements in the early period. Yes, today we have discussed flat foot deformity, a common cause of pain of the feet. There are and there will be improvements on this topic. I strongly remind you to follow the innovations on this subject and don't hesitate to ask what you need. Have a nice and healthy day. Please support us if you like this video and once more.